Hey guys, and welcome back to my channel. This is Confessions of a Doctorholic, and it's your girl, Dr. Slayman, or just Hafsa, if you've been here for a while. And today's confession is about one of the most exciting, surreal, and just straight up weird-ass days of my medical career so far. Let me set the scene for you. I flew on a private jet. Okay, I didn't fly it, but still, private jet. Medicine has its moment. So here's what went down. I'm on the liver transplant team right now, and we had a patient who was status 1A, which basically means she was in acute liver failure and at immediate risk of dying. These patients don't wait long on the list. When a liver becomes available, it's go time. No questions asked. So we packed up and flew to Michigan to retrieve a liver for her. The donor was a brain-dead patient, and this was an urgent recovery case. So brain-dead means that their heart is still pumping, but they would have had a stroke or a motor vehicle accident, so their brain is no longer there. Now I have to talk about the flight because it was kind of everything. No TSA, no waiting, no crowds, just show up at the private terminal and they're like, oh hey, you must be the surgical team. Come right in. The vibe was very VIP. Not in a flashy way, more like a quiet, efficient, you're saving a life kind of way. And yeah, I did ask if I could sit in the cockpit. And no, they didn't let me. Apparently 20-minute flights don't come with cockpit tours. But still, window seat, clear skies, soft takeoff, quick nav, views over the water. It was kind of amazing. So we land, head straight to the donor hospital. The center was clean, calm, super well organized. Everyone knew exactly what to do, and it hit me. How wild is it that this whole system runs so smoothly when someone donates their organs? It feels like a cross between an OR and a funeral home, honestly. There's a quiet reverence to the space. You know, something heavy happened. But there's also kind of a grace to it. This was a brain-dead donor, so as I mentioned before, their heart was still beating. From a surgical perspective, that's ideal. Organs are still perfused, bleeding is controlled, and anatomy is preserved. We began with the abdominal dissection. I got to see the gastrohepatic ligament, help mobilize the liver, take down adhesions, dissect around the IVC, and wrap the intestines. It felt like a scene out of Grey's Anatomy, minus the drama. Well, mostly. Then things got even crazier. The attending turns to me and says, hey, Hassa, have you ever opened a chest before? I was like, no? So naturally, 5 minutes later, I'm holding sternal retractors, heart thudding, mine not theirs, trying not to mess it up. That feeling, holding someone's chest, literally opening up the ribcage, is wild. It feels like you should hesitate, like your hands want to stop, but you can't. You just keep going. At one point, the donor's heart started to fibrillate. Asystole was imminent, and we had to defibrillate. That was surreal. Watching paddles hit the chest, like literally touching the heart, watching the heart bounce back into rhythm, and then I felt it. Not a code, not a CPR moment, but I held the heart in my hand and felt it move. It made me think of cardiac massage, of the line between life and death, of what it means to truly hold a life in your hands. Eventually, the liver was declared viable. The cross clamp went down. Everyone moved quickly, silently, efficiently. It was emotional. Not loud, not dramatic, just weighty. You always have mixed feelings about these cases. On one hand, it's a gift of life. This person, even in death, saved someone else. On the other hand, it's still death. It's heavy, it's weird, it stays with you. And just like that, we packed up the liver and flew back home. I remember looking out the window on the flight back, watching the clouds and thinking, this day was unlike any other. Private jet, organ recovery, holding a beating heart. How do you even process that? All I know is this. I'm so grateful to be doing what I do. The pace, the purpose, the people. It's unreal sometimes. Exhausting, but unforgettable. So yeah, that's today's confession from your favorite Doctorholic. If you're into medicine, fast planes, and slow reflections, I hope this one hit home. If you like this episode, leave a review, hit subscribe, and share it with someone who needs a little reminder that medicine is wild. Until next time, take care of yourself and have a good one.